Hi friends, welcome to classes by Lab Doctor. I'm Dr. Divya, and in today's class let us discuss about hyperkalemia. So what is hyperkalemia? Hyperkalemia is a condition where the potassium level in your blood is more than 5.2 millimoles per liter. So a level, if it is more than 6.5 or 6.2, it is considered to be emergency or a critical value. So this is a normal range of potassium. You can see it varies in adult, children, infants, newborn. So normal range would be something between 3.5 to 5 milliequivalents per liter. When the potassium level is between 5 to 5.9 milliequivalents per liter, we call it as mild hyperkalemia. And suppose if the level of potassium in the serum becomes more than 6.5 milliequivalent per liter, then it is called as severe hyperkalemia. Critical values for the electrolytes. Suppose if the sodium level is less than 120 and more than 160, it is very critical. Similarly, the potassium, if the potassium value is less than 2.5 and if it is more than 6.2, then it is considered as critical. If the chloride is less than 80 and if it is more than 120, if the bicarbonate is less than 10 and more than 40, it is emergency. Are the symptoms of hyperkalemia? How does a patient of hyperkalemia present with? So suppose if the hyperkalemia is mild, patient को कोई symptoms नहीं रहेगा. Suppose if the level of potassium keeps on rising in the blood, then the patient will have few of the symptoms. And the most common symptom which is associated with potassium, may it be hypo and hyper, is the symptom associated with the heart. That is a cardiac symptoms. So patient can have low BP, patient can have arrhythmias, patient can have tiredness, weakness, he can have a feeling of numbness and tingling, there could be nausea, vomiting, he might have trouble breathing, there might be chest pain, and in very severe cases, in extreme cases, high potassium can even cause paralysis and death. That high potassium, it causes muscle weakness because it will prevent the cells from repolarizing and it will lower the resting membrane potential. Because potassium maintains the sodium potassium pump, the increased level of potassium will cause these changes, and this leads to abnormal skeletal and heart muscle function. Avocados, bananas have highest content of potassium in them. Is changing very. Suppose if it is mild hyperkalemia, you might just get this peaked T waves and prolonged PR interval. Suppose if it is moderate, then you might have loss of P wave, there might be prolonged QRS complex, there might be this SG segment elevation, and you might have ectopic beats. Suppose if it is very severe, then there will be progressive widening of this QRS complex, and there could be ventricular fibrillation, there could be bundle branch blocks, etc., and ultimately cardiac failure. So hyperkalemia can also cause abnormal heart and skeletal muscle function because it will lower the resting membrane potential and it will lead to prevention of repolarization, and that leads to muscle paralysis also, because of which the patient might have muscle cramps, he might have weakness. In severe cases it might lead to paralysis also. Patient will feel drowsy. Suppose if the patient's respiratory muscles are affected, he might have difficulty in breathing. And suppose if the patient's abdominal muscles are affected, patients will have diarrhea. So all these functions happen because of the action of the potassium on the sodium potassium pump. So the symptoms of hyperkalemia could be heart palpitation, patient can have muscle weakness or numbness, patient can have nausea, vomiting, he might have diarrhea, chest pain, arrhythmias, abdominal pain, etc. So now, what are the causes of hyperkalemia? So one is excessive potassium intake, so that potassium containing dietary supplements, or it could be intravenous potassium infusion. Fruits like banana, they are rich in potassium. Avocados, they are the rich source of potassium. Sometimes what happens, the patient has renal impairment because of diabetes, hypertension, chronic kidney disease, etc. So when the kidneys are not able to excrete the potassium, the level of potassium might rise because of hormonal abnormalities like Addison's disease, wherein there is deficiency of the mineralocorticoid. Such conditions, it can cause hyperkalemia. Intracellular potassium release in rhabdomyolysis, when the cell breaks, the potassium inside the cells is poured into the serum, causing increased potassium. Suppose if the patient is having tumor lysis syndrome, he is on chemotherapy, etc., and lot of cells are lysed, every cell is going to have potassium, and when the cell lyses, lot of potassium comes into the bloodstream. When there is blood transfusion, we are getting enough and more of blood cells, so all of them contain potassium, so there can be hyperkalemia. Whenever there is hemolysis, can cause increased potassium. When there is low insulin level, like in case of diabetes, I've told you insulin will push the potassium inside the cell. When there is low insulin level, as in diabetes, the potassium level will rise. Certain medications, certain drugs, like you have your beta blockers, so they will cause increased potassium level. Angiotensin converting enzyme inhibitors, certain anti-inflammatory drugs, heparin, tacrolimus, all such drugs can cause hyperkalemia. And there is something called as pseudo hyperkalemia, wherein the level of potassium appears to be elevated. So I've told you Addison's disease. In Addison's disease, there is a deficiency of aldosterone. So what does this aldosterone do? Aldosterone will reabsorb the sodium and excrete the potassium. So in Addison's disease, this aldosterone is deficient. So what happens? Sodium will not be reabsorbed and potassium excretion is stopped. So the potassium level increases in the body, and which will leads to hyperkalemia, and which will cause severe symptoms because of hyperkalemia. So it can cause adrenal crisis as such. So that happens in Addison's disease because of deficiencies of aldosterone. Beta blockers, I've told you. So these beta blockers, they what they do, they affect the sodium potassium ATPase, and because of this, what happens, they can cause increased potassium to get out of the cell, and that can lead to increased potassium in the bloodstream, like atenolol, labetalol. All these beta blockers can increase potassium level in the serum. There is something called as pseudo hypoaldosteronism 1 and 2, wherein these are certain genetic disorders which is characterized by mutations, and patient will also have hyperkalemia. So that can also cause increased potassium level in the blood. That is pseudo hypoaldosteronism. And there is something called as pseudo hyperkalemia. So what is pseudo hyperkalemia? Pseudo hyperkalemia is a false increase in your serum potassium level, which occurs usually during the collection of the blood, or during the storage of the blood, or handling of the blood sample. It is not the true reflection of your serum potassium level in your body. So some of the causes of pseudo hyperkalemia are: if the tourniquet is tied very tight, and increased tension from this tourniquet can cause hyperkalemia. If there is clenched fist, pressure from this clenched fist can release potassium from the cell. If there is mechanical lysis, suppose if there is a mechanical stress during sample handling, such as there is a pneumatic tube delivery configuration, it can break down the cells and it can release the potassium. If there is any fault during blood cooling, or if there is any fault during use of this vacuum tubes for blood draws, that can all lead to lysis of the cell, and that can lead to increased potassium. If you have shaken the syringes very vigorously, that can also cause the breakdown of the cells and increased potassium to come out of the cell, and that can cause hyperkalemia. So this is all pseudo hyperkalemia. So hyperkalemia, the causes could be, it could be diabetes, wherein there is less insulin, and if there is less insulin, decreased entry of potassium into the cells and increased potassium in the blood, so that can cause hyperkalemia. Certain medications, like I've told you, the beta blockers, pseudo aldosteronism 1 and 2, in case of impaired potassium excretion, etc., we might get hyperkalemia. So how do we treat hyperkalemia? So for first thing to do is to stabilize the heart muscles, because I've told you increased potassium causes arrhythmia and heart failure. So first thing is we will have to save the heart. So for that we will have to stabilize the myocardial cell membrane if we see ECG changes, and for that we will have to give calcium gluconate. And after that, for the redistribution of the potassium, to shift the potassium inside the cell, we might have to give insulin. So along with insulin we have to give glucose, because otherwise it will lead to hypoglycemia. We will have to give sodium bicarbonate, and we also give the beta agonist, which will help in the pushing of the potassium into the cell. We give the diuretics, except the potassium sparing diuretics we can give the diuretics, so that the potassium is excreted out of the body. We can give the potassium binding agents like polystyrene sulfonate, etc. And if everything fails, then we will have to go for hemodialysis. So this is how we treat a case of hyperkalemia. So that's all about hyperkalemia, the causes, the symptoms, and the treatment. Thank you so much for watching the video. Please like, share, and subscribe the channel. Thank you.